Hi, my name is Dr. Cary Gans, and thanks for listening to this brief video. The 5 steps in selecting a cosmetic dentist. Now, as a cosmetic dentist myself, I see lots of patients. Some are appropriate for our practice, some are not. And the real question is, how did they come to me? How did they select me as the dentist that they're going to place their trust in? How did they get to my office? Now, how do they know that I'm really the one that's going to help them? Well, there are lots of ways to select a dentist. Now, when you select a cosmetic dentist, there's a slight difference because cosmetic dentistry is voluntary. It's discretionary. You don't need it necessarily to save your teeth. You don't need it to prevent you from having an infection, etc. So selecting a cosmetic dentist is a unique proposition. Now, I've created this 5-part series to try to help you in that endeavor. Now, most of you live in different parts of the country, so you're never coming to my office in Garden City, New York. But if you should be looking for a cosmetic dentist, I hope that this quick video, these 5 videos, and there are 5 parts of this series, will help you make that selection. Now, once again, if you have any further interest, you can certainly give us a call at 516-741-1230, regardless of where you are in the country. Or, more appropriately, go to our website. There's a button there, a little banner that you click on. You can get a free report that will help you in selecting a cosmetic dentist. It'll show you some of the pitfalls. Now, what I'm going to discuss in each of these videos, and hopefully they won't be much more than 4 or 5 minutes in length, are some of the factors you need to think about when you select a cosmetic dentist. And in reality, really, when you select any dentist at all. So let's get started. It's really very simple. There are 5 basic steps that I'm going to suggest to you that you need to follow and you need to think about when you select a dentist, especially a cosmetic dentist. Once again, this is discretionary income. So this is all about you, not them. You're not going to this dentist because you have a toothache or because you need a tooth pulled. You're going because you want your smile enhanced. You want that beautiful smile that you've always wanted. You want to be able to get a new job. You want to be able to go out socially. You want to be able to smile again. So really, it's all about you. Now, if you go to a dentist and they're not willing to listen, if they're not attentive to your needs, if they just try to fit you into a mold, trust me, that's not the practice for you. Cosmetic dentistry requires a team approach, and the most important part of that team is you. So you have to think about what you need and what you want, and there's a difference. You may need to have a front tooth replaced, but what you want is never to have something removable. So my suggestion is this: before you make any appointment, to sit down, think about what you want and what you need. In my practice, most of the patients we see in our Garden City office are people that do not want to wear a denture. So they're willing to do whatever is necessary cosmetically and functionally to avoid that process. That usually involves either caps or bridges of a cemented type or possibly even dental implants. But this is what their needs and wants are, and we try to design a treatment plan that will suit those wants and needs. Next thing you have to think about is how you like to be treated. Because if you don't mind sitting in a reception room where there are lots of people, and where your appointments are a half hour each, it takes a lot of appointments, but you're only there for a half hour. If you don't need specialized attention, then there are certain practices that can attend to those needs. If, however, you want to utilize long appointments so you minimize the number of times you have to come to an office, if you want to be treated in a wonderful atmosphere where all of your needs and wants are attended to, where the dentist takes tremendous amounts of time and the staff is there to help you along the way, well, once again, there are different offices for you. Today they call those boutique type practices. And that's something you have to think about before you select the dentist. Next question is, how were you referred? And we're going to do an entire little video on referrals. But just think about how you got there. Were you referred by a friend, relative, or business associate? Or were you referred possibly by the internet? And there are advantages and disadvantages to each of these. It's something you have to think about when you make the selection. Then you have to think about what's in a title. Now, everybody's got a title. We all have degrees after our name and initials, and this one went here, and this one went there, and this one is a graduate of this, and this one has a fellowship in that. And what does it really mean? Well, we have a little video we're going to talk to you about what's in a title, and how can you discern what those titles mean. And finally, fees. No, it's unfortunate, but nothing in life is cheap. If you want specialized care by a specialized dentist, and you want that to be done in a specialized environment, of course fees are going to be higher. But we have to talk a little bit about fees because there's more to it than meets the eye. Well, anyway, what's important, as far as I can see, is that wherever you are and whatever you do, that the dentist that you're seeing treats you like a king. Because in my opinion, the customer and the patient is king. And everything we do should be done in such a way as to make your time at the dental office as pleasant, as comfortable, and as rewarding as possible. That's just the way we think dentistry should be. That might be a change in paradigm for you. You may not be used to that. But there are plenty of dental offices around the country that are doing it in just that manner. Seek them out because they are there to help you. Now, in the next 4 videos, we will be going into a lot more information. And in part 2, we'll talk about some other things that you need to know, and we're going to go into each of these concepts in a little greater depth. Once again, keeping them to 4 or 5 minutes in length, so that you don't have to sit there and be totally bored by it. If you have any questions, please feel free to call me. And if you need more information, you can always go to our website, because there's a ton of information there. And please feel free to click on that little banner and ask for our free report. We look forward to seeing you at part 2.